Hey there, I'm Dr. Joyce Knieff with Yggdrasil Naturopathic Medicine, and today I'm going to talk a little bit about functional medicine. So, what is functional medicine? There's a lot of different integrative medicines, holistic medicine terms that are out there right now, and functional medicine is very specific because it looks at the function of the body. So, in a nutshell, what functional medicine is how well your body functions. So functional medicine in practice is a medicine that really addresses the root cause of the issue. So when you have something that's going on in your body and you're trying to treat it through a functional medicine lens, the most important part is why. Why is this happening to your body? We want to figure out what is going on in the processes of your body so that we can adjust those processes and make sure that what you're dealing with right now isn't happening anymore. Because we want to treat the function of your body, it's really important in functional medicine to get a really comprehensive intake. So usually the intakes for functional medicine involve a very long questionnaire asking you pretty much your life history, your medical history, your family history, in a lot more depth that you would usually get from your conventional care doctor. And then the first appointment involves a practitioner really going deep in depth with you in terms of intake, clarification of different things that you might be dealing with, a physical exam, and lab work. Lab work that really looks at the functional aspects of your body. What do I mean when I say functional lab work? When I say functional lab work, I mean we look at markers that tell us how your body is working instead of whether or not a value is just high or low. For example, looking at a blood count in your body, that's kind of like is it high or is it low? Versus if we were to look at your blood count, really pay attention to what your blood cells look like, and then run additional markers like, okay, maybe your blood cells are looking a little big. Let's figure out what's going on. That could point to several functional issues that are going on, including B vitamin deficiencies. So we start with a blood test, and instead of just looking at whether or not the marker is high or low, we interpret it, we read into it into a deeper level so we can discover what's going on with the function of your body that needs to be optimized. For example, if your blood cells were a little bit bigger, then we can take a look at your vitamin B12. We can then look at, all right, what is the level of vitamin B12 in your blood? And then further look at what is the utilization of vitamin B12 in your blood. So a functional medicine practitioner wouldn't just look at the blood count. They would look at the B12, and they would also look at something called methylmalonic acid, which is your body's utilization of vitamin B12. So it gets really complex. We have a lot of this happens and this happens and this happens in functional medicine, but this is so that we can make small tweaks down the line and have a big change in how you feel in your health. Because we're so comprehensive in functional medicine, it's also really important that we take into account what's going on with your genetics or your environment. These are generally things that get neglected in conventional medicine, and they just don't get looked at, but they have a really big impact in your health. So with functional medicine, it's really common for us to test in your blood, in your urine, or in your hair, whether or not you have toxic exposures such as to heavy metals or different pesticides or plastics. And then we kind of are able to see how do these things impact your health. Genetics is a very similar thing. The way that your body works, the way that you process your brain chemicals, your neurotransmitters, all of the stuff that your liver tries to detoxify for your body, all of that is going to be influenced by what do your genetics look like. Some people have genetics where their enzymes work super well, and some people maybe not so much. So this is all stuff that we can really take into account in functional medicine in order to optimize your individual health. If you're curious about how functional medicine can benefit you and your individual health, go ahead and visit our website or give us a call. We're always happy to talk.